Forensic odontology. So the term forensic, basically it was a Latin word. The author Clark, he reported the word forensis, which means before the forum or court of law. And odontology is nothing but the study of teeth. So the study of teeth or bone. So the study of teeth or bone which is presented in the court of law, it's nothing but the term forensic odontology. As we are well aware of the term forensic, basically it denotes identification of the remains, skeletal remains. As we know, forensics help us in identifying the individual, help us in identifying the cause of death of the individual, help us in just establishing the reason for the death generally. So when characteristically you want to know the age of the dead individual or the diseased individual, you study the bone and the teeth also to establish the sex of the individual, to identify whether it is a male or a female, to identify who was the person from the remnants of his skeleton. So this dentistry, or this branch of dentistry, the forensic odontology, deals with all these things. So basically the definition of forensic odontology as proposed by the Federation Dentaire International, it is nothing but forensic odontology is a branch of dentistry which deals with the identification of dental evidence, with the examination of dental evidence, and with the proper evaluation and presentation of the dental findings. This definition is given by Federation Dentaire International. So as we can see, forensics or the Department of Forensics is concerned initially with the collection of information, that is evidence collection from the site or from the diseased individual. First evidence is collected, then it is examined by comparative dental identification or any procedure being carried out, post-mortem examination is done. Then this department is also concerned with finally evaluating the evidence collected and giving a proper report or conclusion before the court of law. Even the dentists, they are especially involved in forensic department or the forensic odontology department because teeth are an indicator of our age. Teeth are an indicator of, they show differences in males and females. Both the bones of skeleton, the maxilla, mandible, and the individual teeth, they show differences in males and females. They show differences at the age. So age estimation can be done. You can identify the sex, you can identify the individual. So forensics, forensic odontology has gained importance, that dentists are included in the forensics department to identify the remnants, to identify the individual. So this branch, forensic odontology, it specifically, as I told you, it deals with identifying of the unknown human remains. That is, whatever skeletal remnants are present in case of mass disasters, in case of fire accidents, in case of any war, whatever the skeletal remains of individuals are present, just you can identify by this. This department helps in identification of that skeletal remains. Then to establish the ethnicity or population affinity. That is, there are many ethnic races like Caucasian, Mongoloid, Negro races. So we belong to some Asian race. So to identify from which race the individual has come, the skeletal remains or the teeth and bone are very important. Along with that, the study of bone, it can be used to assess the sex of the individual, to assess the age estimation in case of both the living individuals and the dead individuals. And analysis and identification of bite marks. Bite marks are an indication of any crime occurring, crime assault is there, some form of assault to the individual is there. So the victim, he shows presence of bite marks, and the suspect responsible for causing the bite marks may be identified because of the characteristic features of bite marks. And so the dentist also concerned with after evaluation, they just have to present whatever the report they have made in the court. So dentist also serve as an expert witness. So this branch, forensic odontology, is concerned with these main findings and features. So initially, before the dental identification, the skeletal remnants of body, they were identified but personally. So the deceased individual was identified by his family members. So the family members used to just identify the person either from his physical features, there is a physical appearance, or from his personal things like the cloth, the jewelry. So that form of method is a relatively crude one, because if the suppose the body is completely decomposed, damaged, or completely burnt, you may not be able to identify by physical features. Okay, only the skeletal is remaining, the soft tissue part is completely burned. So in that case, the forensics department comes and it helps in identifying the individual. Okay, so the physical features of the individual may help in identifying us, because the physical features mostly they'll be inherited from the family, and the inherited features like the hair color, height of the individual may also help us in identifying the individual. So that these features, the physical and inherited features, are a group of a personal identifying the patient. And the acquired features, like the suppose the individual during his lifetime, if he has gone some surgeries, so he may present with some surgical scars. So if he has gone with any fractures during his lifetime, he may present with any metallic rods or anything placed in his body, any foreign material, any implants placed in his body to reconstruct the lost parts, the bone parts. That may be the identifying feature characteristic for that particular individual. And these were the general body features which were used to identify the individual. Apart from that, the dental hard tissues gain importance in identifying the person personally, because the teeth have a unique feature in that they are individual and they are specific for each individual. Okay, like two persons do not have similar dental features. Okay, the two individuals will have differences in the all aspects of teeth. Okay, and the dental hard tissues, they are very resistant to any degradation occurring either in decomposition or burning or during any disasters, whatever is happening. So loss of soft tissue and complete body is being burnt, but only the dental tissue, because of the teeth, the bone of the maxilla, mandible, specifically what happens is the bones, they just resist the decomposition, they just resist the damage due to burns, and they are sustaining in the oral cavity, and thus they can be used to identify the individual. So thus, because they are resistant, the dental hard tissues are very resistant. They are resistant even to the post-mortem decomposition. So then the dentists are coming picture, and they are helping us in identify the skeletal remains of the individual. Okay, so dental identification gains importance from the fact that teeth are resistant to post-mortem decomposition also. Okay, so coming to dental identification, there are two forms of dental identification. One is a comparative dental identification. So how do you identify that this is a particular individual? Suppose the family members, they have some of previous his dental records, any x-rays or any cast, any record, any evidence of dental charts or prescriptions present at home, so indicating whatever treatment he has gone. So that's those photographs or pre-treatment X-ray records, they are just compared with the records obtained after death, that is the post-mortem. So both are compared, so that helps us in giving that the individual is this. That is nothing but a dental identification. Okay, and as I told you, human beings, no two individuals have a similar dentition, and the concept of dental identification, it was defined by Acharya and Taylor. Specifically for the Indian population, the author Acharya, he is working for the forensics department, and he is responsible for giving the definition of dental identity. This is nothing but the total of all characteristics of teeth and their associated structures, which while not individually unique, but when considered together, all of the characteristics of teeth are unique to every individual. Okay, single form may not be unique, but when you consider all the teeth in the oral cavity, all combined together are specific for that individual only. The same features of all the teeth may not exist in other individual. So that's helping, that the term dental identity, it's helping us to recognize the fact that teeth are very unique in and it helps us in identifying the individual. So the dental identification procedures, as I told you, one is the comparative dental identification, where the pre-mortem and the ante-mortem records of the individual are just compared with the records obtained post-mortem, and they are just evaluated. And the other is reconstructive identification or dental profiling. In evidences or instances where the pre-mortem or the ante-mortem records are not available, okay, the family members do not have any cast, any photographs, any prescriptions, any x-rays of the deceased individual, or the individual has not gone any form of treatment, then how to identify the individual? You have to just reconstruct the patient's dental profile. So that's carried out in the following steps. That is, oral autopsy is done, then dental records are obtained, then both the post-mortem and the ante-mortem data are compared, then a final report is given. So what is oral autopsy? Oral autopsy is nothing but, we know the medical autopsy, right? Medical autopsy, where the cadaver or the deceased individual is just excised, the body parts are excised, they are cut open, and then each and every organ is just considered individually, and the changes occurring are taken into account. Similarly, oral autopsy is nothing but the surgical exposition of the oral tissues, oral soft tissues, and the bone of the maxilla, mandible, and oral cavity are just examined by surgical excision. What happens here in oral autopsy? You have to keep in mind the rigor mortis occurring after the death of the individual. This rigor mortis is basically making the jaws rigid. So you will not be able to open the mouth of a diseased individual because the jaws will be rigid. So intraoral myotomy is carried out. That is nothing but excision of the muscle, mostly the muscles of the jaws, to just see the oral cavity. And so if suppose the tongue is restricting your examination procedure, the tongue, the floor of the mouth along with few of the soft tissue is just excised, and the tissues are examined. And what features are noticed in oral autopsy? First, you'll see the external soft tissue injuries present, the tissue injuries present intraorally and extraorally. Then you'll just notice the hard tissue fractures. You'll see if there is any fracture in the jaw, if there is any fracture involving the alveolar bone, if any of the teeth are fractured. So any injury to heart structure is noticed. Then the presence of any foreign bodies in the mouth is taken into account. Then the samples of both the hard tissues and soft tissues are collected. So and whenever you are undertaking this oral autopsy procedure, you have to take photographs. Suppose you notice a soft tissue injury, you have to immediately take a photograph. Hard tissue injury, you have to just take a photograph. And then you have to just preserve it for examination at a later stage. And you have to carry a portable radiograph near to the dissection table, and you have to take radiographs of both the extraoral tissue, all the intraoral structures present. Okay, so and all these findings of the soft tissue injuries, the hard tissue injuries, the radiographic, the photographic evidence, everything is collected at the post-mortem autopsy table, and they are just written into a format called the Interpol post-mortem dental odontogram. So whatever examination is done is just noted down. That is nothing but the Interpol post-mortem dental odontogram. So these were the findings of oral autopsy. Okay, now the next step after oral autopsy is nothing but obtaining dental records. So how do you obtain the dental records? So the dental records, once you have to just ask the deceased individuals if he is identified, if the person is identified at the medical autopsy level because of his external features or anything. You have to just establish a communication with the diseased individual's family members and ask him if they are having any dental data like the prescriptions, the x-rays, the photographs of his treatment done, and you have to just make sure that if the individual is identified when because of the medical autopsy, then you have to establish the communication with his dentist. So if one individual, he may be going to a lot of dentists, you have to just track down the level. You have to just go back into the history of patient, and you have to go to the dentist and just collect the records, previous records of x-rays or any thing present with the dentist, any cast or anything. So that constitutes your ante-mortem dental data. Okay, if the individual is not identified one by physical features, or if the individual is not identified, the disease is not identified, then it will be difficult for you to collect the ante-mortem dental data. So this dental record may be present at few times, may not be present at few times. But if present, it helps us, it will be a valuable aid for us in the identification of a person more closely. Okay. So if records are available, they are collected in the form of dental charts, radiographs, casts, or photographs of the individual, pre-operative photographs. Okay, suppose if the record is available, okay, now we are carrying out a comparative dental identification procedure. Okay, only if records are available. So how do you compare it? Now the ante-mortem data and the post-mortem data both are compared. Post-mortem data is the data which you are obtaining at oral autopsy, whichever you are conducting at the dissecting table. Ante-mortem data is just collected from the family. So both of these are compared, and changes in the teeth are noted. Like for example, the working of this comparison works out like, suppose the pre-operative data or the ante-mortem data. Okay, ante-mortem data shows that the right maxillary molar, it is intact. Okay, there is no damage in the right maxillary molar. But when you see a post-mortem data, it is showing a filling in the right maxillary molar. So you can just conclude that, okay, ante-mortem data, the tooth was intact. Okay, but at a later stage, maybe the tooth has gone caries and the individual got a filling done in the right maxillary molar. So yeah, the individual may be the ante-mortem and post-mortem data may be same. Okay, there may be a match because of caries process, he got it filled right. Another example is that there is a filling in the right maxillary molar. The ante-mortem data is showing the filling in the right maxillary molar. But when you examine the post-mortem data, there is no filling in the right maxillary molar. The tooth is intact. So that gives that mismatch report. So the ante-mortem and post-mortem data, there is no correlation. Previously, the filling was present in ante-mortem data and it has just disappeared in the post-mortem data. It means that the individual is not the same. Okay, so this is the concept behind comparative dental identification. Okay, so what features are identified in dental identification? Basically, the morphologic appearances of the teeth, the presence of any pathologies, any dental restorations or fillings are noticed. According to the author Acharya, at least one feature of the ante-mortem and post-mortem data should match to give the report of a identified individual or a probable identified individual. Okay, single point of concordance between ante-mortem and post-mortem data is just necessary to establish the identity, to give that the identified individual is the one who is a deceased. Okay. So next, after oral autopsy, after you have obtained dental record, after you have just evaluated what all evidences you have collected, you have just done a comparative ante-mortem and post-mortem diagnosis, comparison is done. Now you have to just write a report. How to write a report? According to Interpol procedure, you have to give the reports under following terms. The term positive identification indicates that both the ante-mortem and post-mortem data are comparable to each other, they match each other, there is a definite match between the ante-mortem and post-mortem data, so thus the individual is identified. Positive identified. Probable identification is, as we have discussed the example just now, The antemortem data lacks the filling, but the postmortem data shows the restoration. So you have to just presume that the filling was not there in antemortem data because the tooth was intact. At a later stage, he got a caries process, the individual, and he got the tooth filled. So there is some lag in the quality, but the individual may be probably identified. So that you have to write in report probable identification. That is, whatever antemortem data and postmortem data is collected, it is consistent. Okay, it is consistent, but there is a definite lack in quality. That does not include that it is a mismatch. Okay, it may be a probable identification. Then the possible identification is whatever information is obtained, antemortem data may not be available. So the information obtained is insufficient. So you have to give a possible identification. Okay. There is no significant information available, no antemortem data is available. So the term, or you have to write in report insufficient information. Then we have discussed one example, there is a filling in right maxillary molar in the antemortem data. Postmortem data shows an intact tooth surface. So that it is a complete mismatch between the antemortem and postmortem data. It excludes identification. Both the individuals are different. Okay, so you have to write and report in that way. So how do you carry out identification in cases of disasters? In cases of mass disasters like earthquakes, floods, fire accidents, in case of mass disasters like road train accidents, so such hundreds of people will be involved. The death of hundreds of people is occurring in such a stage. So how to identify that individuals? So to identify in mass disasters, the forensic experts team is made and it is just divided into units like the postmortem unit, the antemortem unit, and the comparison and identification unit. So in the postmortem unit, the experts involved, they conduct the autopsy of the individual. Okay, whole body autopsy, medical autopsy is done, photographs are collected, evidences are collected, photographs, radiographs, evidence, whatever possible evidence collect is the experts are able to collect. They just collect from the individual. First initial includes the visual examination or the physical examination of the patient, then the medical autopsy, the reason for death, again the photographs, the radiographs. Okay, all these are just collected. In case of mass disasters like bomb blasts and the train accidents, lot of people are involved. Sometimes you may not be able to collect even the skeletal remains of one individual. So it will be it is a disaster, right? So all the skeletal remains may be mixed. So the identification of the skeletal remains of one particular individual will only take a lot of day for these experts. Okay, the post-mortem unit performs its function. The anti-mortem units. The anti-mortem unit, the function of anti-mortem unit is, suppose the body has been identified by personal identification or physical identification. The deceased, the family members of deceased have just identified the body through physical features or through clothes, jewelry or something. In such instances, you have to just ask the patient, ask the persons who are identifying the deceased individuals for any records available with them to compare. Any records, any dental record, any general body x-rays, any treatment or any surgeries done, any prescriptions, so that you can compare both the deceased individual, the dead, and the family members. So to establish the identity. What happens is, in case of mass disasters and all, if you identify the individual correctly, it may help in legal proceedings. Okay, problems of insurance may be sorted out, or problems of any lineages or hereditary problems like transfer of property and all matters relating to worldly things will be sorted out if this identification is done exactly and accurately. So the function of antemortem data is to collect or track the level of history of the deceased individual and just collect whatever data is they are able to collect. Now the comparative and identification unit, they just compare the antemortem and postmortem data. Nowadays, the Interpol has developed a lot of software programs like the Identify, Odontite, Campy, and IDs. These are nothing but computer software programs. So whatever reports we are noting down, whatever evidence we are collecting, so these softwares help us in identifying or matching both the antemortem and postmortem data and giving us a diagnosis. So identification from the dental DNA. As I told you, teeth are the one which are resistant to even post-mortem decomposition. The teeth and all the dental materials, whatever are used by dentists to restore the damaged tooth, those are also resistant to damage by decomposition, damage by heat. So the teeth, they just tend to be intact. Okay, so that's why the pulp tissue present in the teeth, it is also intact, and it helps in identification of individual because it is the source of DNA. The pulp is a rich source of DNA, and because the teeth are not decomposed, we can just extract the pulp from the tooth. Suppose the body is completely decomposed and burned and only the teeth are present, that is just sufficient to extract DNA from the pulp and compare this DNA whichever is extracted from the hair of the individual present at home. It may be present in the hairbrush or comb, or epithelial cells present in the toothbud or toothbrush. All these are the sources of DNA. So those are compared with the DNA present in the dental pulp, and this both help us in identifying or giving a correct diagnosis of the individual. So basically there are two types of DNA. There is the nuclear DNA and the mitochondrial DNA. The nuclear DNA helps us in establishing, giving a correct diagnosis, and the polymerase chain reaction, the procedure is carried out nowadays just to process the DNA, whatever is collected, and compare it with the siblings or with the diseased individuals, so claimed family members, and you can give a correct diagnosis by this DNA extracted. DNA also may be extracted from the dentine and cementum tissue also. Okay, so that was all about the comparative dental identification and identification in case of mass disasters. Okay, now palatal RUGAE has also gained significant importance in identification because the palatal RUGAE are nothing but the soft tissue structures present behind the central incisors. They are present in the midline. They just seems to extend on the either side. The RUGAE are the structures which are relatively resistant to any deformation or decomposition post-death. So what happens is these RUGAE are basically protected from damage because of the teeth present. The teeth are resistant to decomposition. The RUGAE are relatively behind the central incisors or lateral incisors. So these RUGAE are structures which are basically protected from any damage occurring during the death of the individual. So, and there is unique feature of RUGAE that they are specific to specific individual. No two individuals have the same pattern of RUGAE. So this pattern of RUGAE helps us in identifying the individual. You have to compare the structure of RUGAE, the pattern of RUGAE, to that of any antemortem data available. Antemortem data may be a denture of the patient available at home or any cast of the patient available at home. If you compare the both, that gives the identification of the individual. And the RUGAE are unique in that they never change with the age. They seem to be showing a same pattern throughout the life of the individual. And there are different types of RUGAE. There is a primary RUGAE when they are less than 5 mm, more than 5 mm, and secondary RUGAE when they are between 3 to 5 mm, and fragmentary RUGAE when they are between 2 to 3 mm. RUGAE less than 2 mm are just not taken into consideration. Again, after obtaining the pre-antemortem data, you have to just take the post-mortem impressions of the patient by impression materials. Polyvinyl siloxane is the most common impression material used. It is just used to take the record the hard tissue structures and the soft tissue structures and the palatal RUGAE, and the casts are poured and just they are identified. And nowadays what happens is there are a lot of computer softwares available. What they do is they just mark few of the specific points present in the RUGAE, and both the antemortem and postmortem data are just compared by the computer software, and they just give a diagnosis if the individual is identified, if it is a probable identification or a possible identification, at what level the match is present between the antemortem and postmortem data. Okay, so the RUGAE are also very important and unique to the individual. So now we have done the comparative identification. Reconstructive dental identification is nothing but dental profiling. Okay, how do you do the dental profiling? How do you identify the individual just by teeth? Initially, the first attempt at identifying the individual through dental tissues, maybe first the identifying the ethnicity or the establishing the ethnic origin of the individual from the teeth. So as I told you, there are a lot of races present in worldwide: Caucasoid, Negroes, Mongoloids, Asians. So based on the presence of few specific characteristics in only one particular race, they were divided. The races were divided. Okay, so they are unique. Some few of the races show few particular characteristics only. So we can identify the race by identifying the structures of teeth. So we have to basically identify or measure the size of the tooth. That is nothing but the metric traits present, and the non-metric traits are the characteristic trait present in feature of the tooth. Okay, the shape of the tooth may be different. There may be present of few of the cusps. A few of the cusps may not be present. Few of the teeth, they show a characteristic trait present unique for that particular teeth or that particular race only. So the metric traits and non-metric traits are just characterized for after identifying post-mortem the individual. Okay, the non-metric dental traits. The tooth size traits, as I told you, they are nothing but measuring the mesodistal dimension of the tooth. Those denote the metric traits. The mesodistal dimension may be little bit lesser in females when compared to males, so that gives us an identification of the sex of the individual. And the mesodistal dimensions of children may be different, the adult may be different, the deciduous tooth may be different, the permanent tooth may be different. So even the ethnic characteristics of individual, the races, few of the races, they show extremely smaller teeth. So all these metric traits help us in identifying the ethnic origin. Now we are coming to the non-metric dental traits. I know non-metric dental traits are nothing but the few of the characteristic traits present in that particular teeth only, like the presence of shoveling. Shoveling is nothing but the presence of mesial and distal marginal ridges on the lingual surfaces of maxillary anterior teeth. Maxillary anterior teeth on the lingual surface, they just show the prominence of this mesial and distal marginal ridges. That characteristic trait is nothing but shoveling. Caravelli's trait is another non-metric trait. It is nothing but a cingulum present on the maxillary molars. Okay, maxillary molars, they just show presence of a characteristic cingulum giving the appearance of Caravelli's trait. Three cusp maxillary second molar may be present with the prominence of the distal lingual cusp giving the appearance of a three cusp maxillary molar. Then sometimes what happens is the distal margins of maxillary central incisors, they show some rotation bilabially. That is nothing but winging, and mandibular molar groove pattern may be characteristic, and sometimes the four cusp mandibular molars may be seen. So these unique features help us in identifying the ethnicity of the individual. So now along with the dental profiling, we'll see how the sex of the individual is identified based on the skeletal features, the dental features and the skeletal features. So basically the bones of maxilla and mandible, they show differences in males and females. Even the individual tooth may be showing different features. The skull may be showing different features. So we'll see the craniofacial morphology or the difference in males and females, how it is established. Okay, right? The skull, the prominence of glabella is seen in cases of males because they have a marked glabella curve seen on the frontal bones, whereas the females, they show a flat or a slight curve. Whereas the orbits in case of males, they may be square shaped and show low rounded margins. When you see females, they show the rounded but very sharp margins, and the orbits may be little bit smaller in size. And when you see the nasal aperture in case of males, They may show presence of high and sharp, very thin margins. Whereas in case of females, the nasal apertures or the presence of holes, they may be at a lower level, and they'll be little bit rounder and smaller margins present. And when we see the occipital condyles, they may be larger in males and smaller in females. And the foramen magnum, or the place where all the structures pass through, it will be little bit wider and larger in case of males and smaller and round in case of females. And even the glenoid fossa, it is very shallow in females, and the palate in case of males, it is very large U-shaped palate. In case of females, it is very smaller and appears to be V-shaped or parabolic. So those are the general features of male. Now we'll see the individual features of involving specifically the maxillary and the mandibular bone. Now if you see the ascending ramus, in case of males it is very large and broad, and in case of females it is small and narrow. And the condyles are very large in males and they are small in females. And the shape of the chin, in males it is square shaped, and in females again it is rounded. And even the gonial angle, the mandibular angle, it is relatively more obtuse in case of females when compared to males. And the angular height of the mandible, it is low in case of females. Okay, so the characteristic morphologic differences in the skull, in the mandible, they help us in identifying the sex of the individual. Dental age estimation, the teeth help us in identifying the sex of the individual and even the age of the individual. The teeth show differences in calcification, differences in eruption, difference in the eruption of teeth, difference in formation of teeth. All these are characteristic that the infants show different levels of calcification. The adults may show complete different changes in the morphology or histology of teeth. So all these helps us in identifying the age of the individual, because the teeth during their lifetime, after eruption, during the embryonic development, they may show differences in calcification. Whereas during the adult life, after complete eruption into the oral cavity, they may show some morphologic, some histologic changes, some regressive changes occurring throughout the life of the individual, which helps in identifying at what stage, at what age, what changes are occurring in the teeth. So based on that, you can identify the age of the individual. Age estimation in prenatal children will be different. Age estimation in adolescents and adults can be carried out, and final will be the age estimation in case of adults. So in case of children, prenatal age estimation is important. Suppose what happens is few of the cases of infanticide and feticide. Okay, skeletal remains of individuals may be given to the forensic expert to identify the age or the time at which the fetus was aborted. Okay, so that age estimation in prenatal comes in picture there. So how do you identify the age estimation? Initially what happens is the calcification of teeth was taken into account. We know the calcification of teeth, it just begins at the 3 to 4 weeks intrauterine, 7 weeks intrauterine, and it just progresses about 3 to 5 months intrauterine. Okay, and mostly by about 14 months post birth, almost all the teeth of oral cavity are calcified. Even the permanent teeth show calcification. So in case of a live individual, you can identify the teeth by this features. There is the calcification of teeth. Okay. Other may be a neonatal line. Neonatal line is nothing but the distinction between the teeth, the calcification of teeth which is occurring before birth and after birth. It may be present in few individuals, it may be absent in few individuals, but neonatal line is considered as a characteristic indicator of a live birth individual, because it is showing differences in eruption or differences in maturity of both the mineralization process of the pre-birth enamel and the post-birth enamel. Okay, so the age estimation can be done based on the presence or absence of neonatal line. Okay, if the neonatal line is absent, the individual may be considered a stillborn individual or a stillbirth individual. If the neonatal line is present, based on the level of neonatal line, you can just identify what is the age of the infant. Okay, if suppose you were given a skeletal remain of the individual, the child was just aborted, he's just the fetus was aborted, in case of feticide, you are given a skeletal remain. So you have to just compare the dry weight of the mineralized tooth cusp of the deciduous central incisor, lateral incisor and first molars. The mineralized dry weight gives you the exact dental age, because the total dry weight will be about 0.5 grams in case of live birth individuals or newborn infants. Okay. The age estimation in children and adolescents. Okay, in children aged about 5-6 years, age estimation depends on the tooth eruption in the oral cavity, tooth emergence in the oral cavity, and even the tooth calcification. This is method is relatively simple because it just depends on identifying the emergence or eruption of teeth which is just clinically visible to you. Okay, clinical or visual assessment of teeth is carried out. The number of teeth present in mouth are seen, the erupted teeth are counted, and that gives us the level, because we know the tooth eruption happens, it is a very tedious process. Few of the teeth show characteristic appearance in few years only, like the premolars begin to erupt only at about 11 to 12 years of age. So that is characteristic of the particular tooth. So the visual assessment helps us in identifying age in case of children and adolescents. And the particular Scour and Maslow's method is carried out, where what happens is the Scour and Maslow, they just gave a dental chart to identify the eruption of teeth or the stages of eruption of teeth. The Scour and Maslow, what they did is they gave 20 chronological stages of teeth starting from about 5 months intrauterine to about 21 years of age. Based on these charts, you can just identify what is the age of the individual. And age estimation in adolescents, it is carried out by Demirjian's method. Demirjian's method, basically what happens is he also gave different stages for different tooth development stage. Okay, he just divided the stages from letters A to H. Okay, and the stages, they were numbered as 0 to 9, and we'll see the stages. The characteristically, the stage 0, it was shown that the tooth calcification has not yet begun. Okay, the stage 5 shows that the crown of teeth is completely erupted, whereas the stage 9 shows that the tooth is completely calcified. Then for each tooth, the scores were obtained. The final scores, the scores assigned for each of the 8 teeth. The Demirjian, he basically collected information and from the mandibular left side. Okay, he just carried out his experiments on the 8 teeth of the mandibular left side, which were named A to H, and each of them was given a particular stage. Stage 0 is no calcification, stage 5 is crown is completed, stage 9 is complete calcification has occurred. Then the scores of each of the teeth, assigned teeth, were collected and a total maturity score S was obtained. Finally, the Demirjian, he gave a formula for identification of age, which is different in males and females. For males, it is age is equal to 27.431 minus 0.0097 into S2. S2 is nothing but the total maturity score, which is added with the 0.000089 into S3. Okay, the females, the age is estimated by the formula 23.7288 minus 0.0088 into S2 plus 0.000085 into S3. There is nothing but a formula used for age estimation cases of Demirjian's method. Initially, Demirjian, he considered the mandibular left 8 teeth. He did not consider the third molars for estimating the age. Okay. And the Demirjian's method is useful in identifying if the individual has become 18 years or not. Okay, third molars were also very valuable in age estimation. What happens is third molar, it is actually an indicator of the age group that the third molars erupt at about 16 to 22 years of age. So that particular age group, they show the beginning of eruption or emergence of the third molar. So this third molars may be used to identify if the individual is a juvenile or adult, and 18 years is the exact age for third molars, and 18 years is also the age at which the laws applicable to child change from juvenile to adult, and 18 years is considered a characteristic age for the individual to enter adult period. So the laws are very stringent for adults when compared to juveniles. They are relatively different. So a lot of cases or crimes involving the children and adult, they just have to be differentiated if the suspect or the individual is a juvenile or adult. In such cases, third molars come into picture and they give us a correct identification or estimation of the age. And the author Acharya, he reported that the use of third molars in age estimation is approximately 73.2% correct. Okay, and in cases of adults, adults basically they show a lot of changes. Once the tooth has erupted, the calcification, initially in children calcification was the problem, whereas in adolescents the time of eruption was taken into consideration. Whereas when coming to adults, the tooth has completely erupted into oral cavity and it has been in oral cavity for a lot of years, and it is showing a lot of morphologic changes, histologic changes, biochemical changes occurring in the oral cavity, all just affect the tooth. Morphologic changes is nothing but attreated. The tooth may be attreated in the lifetime of the individual. So these sort of morphologic changes, they help us in identifying the age of the individual. Those are nothing but the age estimation in adults is carried out based on these changes. So Gustafson's method is based on morphologic and histologic changes of the teeth. Gustafson basically he just measured the regressive changes which are occurring in the teeth, and based on the regressive changes he gave the age estimation in adults. He estimated the age in adults based on the formula. The regressive changes, whatever he considered, are attrition of the teeth, secondary dentin deposition, loss of periodontal attachment and cementum opposition at the root apex, and the root resorption at the apex, and the dentin translucency. So based on these regressive changes, he just identified or estimated the age based on the formula 11.43 plus 4.56 into x. Here x is nothing but the total score obtained after comparing all the regressive changes. Okay, and the regressive changes, as they are denoted by the terms A, S, P, C, R, T. So the number of regressive changes located total in the oral cavity. Suppose attrition is noted in 4 teeth, A4. Like that it was counted and it was given from grades 0 to 3 and a total score was obtained. Finally, the formula helps us in identifying the age. So that's based on the age estimation formula. Then a few of the authors proposed that the Gustafson's method is not accurate in that it is considering a lot of changes which are just which may not show a direct relation to age, because the attrition may be seen even in children, even in younger people also, younger individuals also, if suppose they have any underlying habit and all. So that all criteria of the Gustafson's were not correct. So this dentin translucency method came into picture. According to this belief that the root dentin just starts to become translucent in the third decade of life. So the diameter of dentinal tubule just decreases because of deposition of calcified tissue intratubularly, or inside the dentinal tubules just the dentin is being deposited, and the diameter of dentinal tubules is just becoming small. So there is some difference in the refractive index between the intratubular material and the extratubular inorganic material. So this results in increased translucency of the affected dentin. So the levels of translucency, they just begin from the root apex to the cervical region. Translucency lengths were measured. Okay. So this Brang and Ram's formula was used based on translucency to measure the age. Okay, he gave the formula as 35.5619 plus 3.4828 into T. T is nothing but the translucency. The translucency length obtained either on the palatal side, buccal side, they help us in identifying the age. And so the third molars were used, the dentin translucency, and sometimes incremental lines of cementum were deposited in the cementum during the later stages of life. Incremental lines of cementum, they were also considered in estimating the age of the individual. Okay, but anyways, we have seen the most commonly used methods for age estimation in case of adults, in case of children, adolescents, in case of pre-adolescents or infants also. Okay, now we'll see the characteristic other apart from the dentinal soft tissue injuries are also occurring. Apart from the hard tissue injuries, soft tissue injuries to the individuals are also just noted because they help us in identifying the suspect. Or soft tissue injuries, basically they are involved in cases of crimes or assaults, right? So any injury inflicted to the victim may be characteristic because the suspect may be identified by that particular injury. So we'll study the bite marks. Okay, the bite marks, basically they are defined by McDonald as a mark caused by teeth either alone or in combination with other mouth parts. Other mouth parts are nothing but the oral soft tissues, the palate, the rugae, which are seen in the oral cavity. Basically, I told you bite marks are reason of a criminal investigation. Okay, the forensic investigation is an identification of the individual mass disasters. Bite mark is for criminal investigation. So the bite marks are unique in that the bite marks are basically, they are caused by the teeth, right? And we know teeth are very, very unique and specific, that no two individuals have a similar appearances of all the teeth, and the teeth marks given by two individuals are also completely different. Okay, so there are a lot of classifications based on what criteria the bite marks were classified. As we know, the bite marks may be caused by human beings, may be caused by animals, and in human beings the most common reasons for bite marks were the sexual assaults, and the appearances of bite marks were seen on breasts, on hands, legs, feet, shoulders, anywhere in the oral cavity. Basically, the bite mark was a common assault or abuse occurring to the victim. Okay, based on the agents Cameron and Sims, they just classified the bite marks into human bite marks, animal bite marks. Based on the materials, they were classified if the bite marks were occurring on skin, if bite marks were occurring on foodstuff or any other materials. And McDonald, basically he classified bite marks as a tooth pressure mark, that is the mark which is caused only by the indentations of the teeth or the tooth pressure. Tongue pressure mark includes the marks which are caused by both the teeth and the tongue, and when the tongue is involved, along with the presence of bite mark, there is a central area of ecchymosis seen in that particular mark. That is because of the pressure. What happens is when tongue is used, there is negative pressure, and that leads to suckling effect, and that leads to the central ecchymosis within the mark. The tooth scrape mark is nothing but what happens is during the bite, sometimes the tooth is just scraped onto the victim, and that leads to appearance of scratches along the bite mark. That is nothing but the tooth scrape mark. Then the Webster, he classified the appearances of bite mark based on the penetration of teeth, at how much level the teeth are penetrated, that characteristic of that particular bite mark. Type 1 type of bite marks include the limited depth of penetration of teeth. This is seen in cases of if the suspect or the individual, any of them, if they just bites the chocolate, okay, like a dark chocolate, there is a limited depth of penetration for the teeth to penetrate. For you to eat the chocolate, there is only little amount of penetration needed. That includes the type 1 bite mark. Type 2 bite marks include things which show considerable depth of penetration of teeth. Like suppose the suspect, in case of robbery, he is just biting an apple. He is just leaving his marks on the apple. Apple is a little bit hard tissue, harder structure, substance. So all of the teeth are penetrated. They show considerable depth of penetration. Type 3 includes the substances which show complete or near complete penetration of the food. This is seen in case of cheese material. Okay. Now, how do you identify the bite mark? Whenever you see a bite mark, you have to just ask few questions to yourself while investigating it. What kind of bite mark it is? Is it a bite mark? Is it caused by animals or humans? So what may be the suspected individual? Those are only tooth pressure mark or the tongue pressure marks, or any central ecchymosis is seen or not. So you have to just ask few of the questions before when you are carrying the investigation. And the visual examination of the bite mark has to be carried out. You have to take the photographs, both at a distance side and a close-up photographs also. Bite marks are very unique in that what happens is the bite marks may disappear very rapidly also, because of the healing process occurring in our body. Any marks left, they just tend to heal within 24 to 48 hours. So as soon as you just come in contact with the individual, you have to just take photographs of the individual and just store it for future evaluation purposes. Or suppose that the individual has died after sustaining the injury, the bite marks just tend to remain like that only, because once the individual dies, there is no healing process occurring. So you have to just take the photographs, impressions if possible, impressions of that particular bite mark area is taken. And bite mark is a source of DNA, because along with whenever tooth bite mark is present, or whenever the saliva bite mark is present, saliva is invariably involved because it is present in the oral cavity. So that may be source of DNA also, bite mark. So you have to just swab the surface of bite mark and collect any ductal epithelial cells or saliva present there. So how do you, initially you have the visual examination is done, and the appearance of bite mark is seen. First you see the gross characteristics of the bite mark, that is how is the bite mark appearing. Is it circular, is it elliptical, and is there presence of any ecchymosis on the skin, or is there presence of any other deformity within the bite mark, like the scrap marks and all. And the marks left, how are they appearing, whether we know that each teeth has a different structure, it leaves a different form of mark. Like the incisors leave a rectangular mark, canines leave a triangular mark, premolars and molars they leave a spherical or pointed shape mark. You have to just observe the characteristics, class characteristics of each of the mark left, and how is there any difference in the one particular class characteristic. Okay, suppose the incisors may have some at least class 3 fracture or class 4 fracture, so the mark produced by that incisors will be little bit different, right? So you have to just notice the individual characteristics of the bite marks. So while evaluating a case of bite mark, you have to just first carry out the following procedure. The visual examination is done, photography, saliva swab is done, impressions of the tissue are collected. So thus evidence is collected from the suspect. So it is just examined and compared with the suspect. What happens is, you can if you suspect any individual of causing the following injury to the victim, you have to just collect the photographs of the individual, the impressions of the individual, the cast of the individual, the molds of the individual, everything is just taken, and now you will carry out a comparison between the evidence you have collected from the victim and the suspect. Now the photographs of the bite mark, they are just enlarged to human size, and they are just compared with the cast obtained from the suspect. The cast of the suspect is kept on the bite mark, and it is observed for any changes or any similarities between the tooth, and suppose the impression of the bite mark is present, that is compared with the impression obtained from the suspect, and any probable possibilities of identification or matching are done. Okay, so in that way identification is carried out, and you'll give a conclusion after bite mark analysis if there is a definite match between the bite mark caused by the present on the victim and the characteristic appearance, morphologic appearance of the suspect. If both are similar, definitely that is the biter. Probable biter, that is few of the match between the individual and suspect bite marks is about 50%. Possible and biter, it is the may be a biter, but the clinical symptoms or the clinical evidences just lack a quality. Not the biter, that is the marks caused on the victim are completely different from the impressions obtained from the suspect. So he may not be the biter. So you write the report in such way. And in forensics department, we have seen that the fingerprints are more commonly used to identify the individual. Okay, in cases of deceased individuals, suppose when the body is completely decomposed or burnt, the fingerprints may lack that quality to identify the individual. The deceased individual especially. In such instances or in cases of crime scenes, we have seen that the lip prints, the marks left by the lips, a lot of people use the lipstick on their lips, right? So any marks left by the lipstick or the lip prints, as we call, help us in criminal investigation or identifying the suspect or identifying the victim. The victim's body may show the appearances of lip prints that does help us in identifying the suspect. So the lip prints, basically they were called as sulci labiorum rubrorum. Okay, the lip prints, basically they are nothing but the lip has a lot of grooves and sulcus present on its surface. So they leave a characteristic mark whenever they come in contact with any surface, body, or any glass like a thing. So these lip prints are very characteristic. They are different for each of the individual. The study of lip prints is termed as chiloscopy. So it helps in identifying the suspect or the individual who is causing the problem. Okay, the victim who is causing the problem to the victim. So the suspect is identified. The criminal investigation cases More commonly, they are carried out by this lip print. The imprint produced by the grooves, it is termed as lip print. Basically, these grooves and sulci are nothing but the wrinkles appearing on the lip surfaces. How are these? Simple wrinkles are nothing but they may show appearances of a straight line groove or a curved line, angle line, or a sign-shaped curve. Compound wrinkles are which may be bifurcated, trifurcated, anomalous. So basically he carried out the study of lip prints. He divided the lip prints into the following types. Type 1 is where clear-cut vertical grooves are present on the surface that run across the entire lip. Type 1 hash is nothing but it is similar to type 1, a variant of type 1, but they do not cover the entire lip. Type 2 includes presence of branched grooves. Type 3 they include the presence of intersected grooves on lip. Type 4 includes the reticular grooves. Type 5 includes grooves that cannot be morphologically differentiated. So how do you carry out the procedure of lip printing? You just divide the two lips into quadrants, 4 quadrants, that is the right and left side and the upper and lower lip quadrant. So based on that, the presence of grooves in each particular lip is just seen, whether the grooves present are just vertical simple grooves or branched grooves, whether they are intersected, the grooves are just communicating with each other, or the presence of branching division like grooves, and the grooves which cannot be just seen morphologically. But the problem arises in lip printing is that when you see the transition zone between the vermilion border and the adjacent skin, that particular region, whenever it is recorded in the print, because it is extremely mobile zone, it may present different features when different form when different amount of pressure is applied. So even the same individual, when different amounts of pressure is applied, the appearance of grooves may be different for that individual. So sometimes the print of the same individual may be mistakenly identified as that of other individuals. So that is the one disadvantage of lip printing. And but the grooves are very characteristic, that siblings or the appearance of groove are very individual in identifying the suspect in cases of the crime scenes. So that's about the lip printing or lip grooves. And along with the characteristic grooves, few of the sebaceous glands openings will be present along the vermilion border or the vermilion zone. Even in cases where the lip printing or the lip prints are masked, because nowadays there are lipsticks which are not being seen or which do not leave any mark on the surface they come in contact with. So even in such instances, because of the secretion of oil, sebaceous glands present in the transition zone, vermilion zone, they just secrete little amount of oil, and that helps in giving us the print or the appearance of lip print. Along with that, the prints which have been left by wearing or the lipstick which does not leave a print, even that can be identified by aluminum oxide powder and the magnesium powder. The oil sebaceous glands are invariably helpful in identifying the lip print. So that crime investigation procedures involving the lips are nothing but the kiloscopy. So that was about the forensic odontology. So the hard tissues, the soft tissues, everything helps us in giving a correct or a probable identification of the deceased individual along with the living individual.